Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A couple of quick notes before we jump into our interview with Dr. Fine. First, if you haven't seen it, take a look. Aaron Wren, urbanist and just generally smart guy, talking about what the implications of the coronavirus in the short and long term on cities across the country. And also want to thank Courtney Nicolato from the United Way, who gave a sobering picture about what the need is amongst the nonprofit community here in Rhode Island, an immediate need to raise about $5 million. So if you've got the resources, you can make a sacrifice. Please go to United Way of Rhode Island and make a donation to try and help the coronavirus fund as soon as you can. And now let's go to Dr. Michael Fine, former Director of Health to the state of Rhode Island. Dr. Fine, thanks so much for joining us.
Great to be here. Good afternoon.
Great. Let's go to the numbers first up. Some sad numbers. 41,000 Americans have passed away, an increase of 20,000 in seven days.
Unfortunately, very unfortunately, and probably not an overwhelming surprise, we're going to see more of that. And as I said, we will be very lucky if we get to the end of the summer without seeing 100,000 deaths. 2.4 something million cases around the world. We'll cross 2.5 million today. 767,000 cases in the United States. We'll probably cross 780,000 and maybe get close to 800,000 by the day's end. Remember, there's a lag in reporting over the weekends. Usually 166,000 deaths around the world, and as you said, 41,000 deaths in the United States. I would expect to see some bigger numbers than usual today because the numbers were a little slow in coming over the weekend. The numbers are not slow; they're painful, but they don't arrive in their usual fashion over Saturday and Sunday. 13 recent deaths in Rhode Island. We'll hear more about that from the governor in about 30 minutes. Rhode Island cases are at 4,700. Will likely pass 5,000 today or tomorrow. Our ICU numbers are climbing, but climbing in a constant, not an explosive way, as are our hospitalized numbers. About 150 deaths so far in Rhode Island, and I think we will be lucky if we get out of the summer under 1,000, and very lucky if we're under 500.
Dr. Fine, yesterday at the briefing, the governor said that the peak is functionally 3 weeks away, 2 to 3 weeks away. She'd also made that utterance on Friday as well. Then at the White House task force briefing, Vice President Pence put Rhode Island along with New York and Connecticut, I think New Jersey, in a bucket that have already hit their peaks. Two conflicting pieces of information at the state and federal level. How does that happen, and how is this miscommunication now 6-7 weeks into this crisis still going on?
Oh, I think the governor's numbers are way better. I'm guessing that what they're worried about in Washington for Rhode Island isn't the number of cases, but the number of deaths. Because our percentage death rate is reasonably high, that's, I think, to some extent, because we have two populations at great risk. The greatest risk are people over 85, where we have a very high concentration of that population nationally, and then the Hispanic population, which is shown to be at risk, and the folks who live in densely populated areas. You know, if you watch these numbers as I do, you see Providence and Pawtucket and Central Falls climbing way too rapidly, and that is what I think they must be looking at. But I don't think that crest has come in any of those communities yet, unfortunately.
Let's go to nursing homes. We're seeing tremendous death rates and tremendous number of deaths here in Rhode Island from the nursing homes. Did we not learn the lessons of what happened in other states, especially the state of Washington, which got hit in January? with really the first major breakout. Should nursing homes in Rhode Island been broken down and separated, or should they have been isolated as well as the staff's been isolated to be able to limit the amount of exposure?
Well, I think you have to realize that this is a virus we're learning about every day. So I'm not going to go back and say should have, because a month ago we didn't know what we know now. And what we know now that's most important is that this virus is often carried in asymptomatically, but can be transmitted from someone who's asymptomatic. We didn't know that then. And we also didn't quite understand the extent to which the virus aerosolizes. So it gets into the air and stays in the air for hours, which is something that is unlike most of the other sort of flu-like viruses we run into. That's much more like measles. And now that we know those things, we can make some different choices, but we're really behind the eight ball in terms of making them. Kudos to my colleagues at the Department of Health who have suggested starting to test residents and staff weekly. That's a good thing, but it doesn't get us past this problem of asymptomatic transmission. And in order to get past that, it would take resources like I don't think we've ever seen. It would basically take isolating anyone who's going to work in a nursing home or walk into a nursing home for 2 weeks before they go in, testing them before they go in, and even that, then there is some chance that we'll miss some people. Remember that once this virus gets into a nursing home, as far as I'm concerned, it's basically unstoppable.
So once it's in a nursing home, let's pick up on that theme. The Department of Health is now only disclosing the nursing homes that have 5 confirmed cases, will not publicly disclose those that have less than 5 cases. One, should that policy be changed? And two, okay, the cat's out of the bag. Once it's in the nursing home, what steps should be taken of that nursing home?
Well, I think they're taking all the steps that they have taken traditionally and that have traditionally worked, which means once it's there, you isolate the person who's ill, if it's only one person, to kind of a wing on their own so that they are physically separated from others in the nursing home. You make sure that the staff who's taking care of them doesn't go from patient to patient. So if you're taking care of the COVID-19 patient or patients, that's all you do, and you don't do anything else. Those are the things that we are doing, and I think doing aggressively. And I think it's keeping the lid on it, but how well that's going to work over time, is really questionable to me because of these two problems of the aerosolization of the virus and asymptomatic carriage.
And listen, if that staff goes home each night and goes and walks into their house, and even if they take a number of precautions and no one appears to be ill in their family, their direct family, that still doesn't help the situation because there's further opportunity for exposure.
It doesn't make it impenetrable. You're right. That's why I said the only way to do this that I can think of would be to basically give people a place to live, isolate them for 2 weeks before they come into a nursing home. Anybody who walks into a nursing home ought to go through that. They need to stay in isolation and not go home while they're working in the nursing home. We need to be testing them frequently. I just don't know how much of that is really practical in the world that we have.
Well, and practical, in many cases, folks who work in nursing home are not the highest paid people, barely above minimum wage in some positions. Why would they agree to that level of sacrifice of uprooting their entire families? And in some cases, they're the sole caretaker for their children.
That's right. That's where I'm not convinced that I see that it's practical today. Maybe in 5 years where we train a whole cadre of, specialized people who we pay really well to do it, maybe then, but I'm not sure that I see us getting there so quick. We've been underpaying, particularly CNAs, but CNAs and nurses together in nursing homes for longer than you can imagine, and underpaying them hugely. We ought to change that tomorrow.
And obviously there's a coalition that is saying that Rhode Island is amongst the lowest staffed nursing homes as well, 44th in the country as to the number of hours that is dedicated to each of those nursing homes.
Yeah, I mean, you have to have enough people. You have to be training enough people. We have, as a state, neglected our healthcare workforce for as long as I can remember. We just don't really have a state workforce policy and approach, so we calculate how many people we need to train and make sure that we get them trained. This has been a hole in our health policy for years and years.
Indexing Latinos and African Americans, numbers GoLocal ran this morning, 60% of those who have tested positive are either Latino or African Americans, far out indexing the rest of the population in Rhode Island. Latinos three times the index, African Americans 50% higher. What did we do wrong? How do we turn this around? Do we just have to realize that traditional maybe media sources and online Facebook Lives is not going to be enough to get the message out to diverse populations?
No, I don't think this is, you get the virus because of what you read. You get the virus because of what you do or have to do. I read a statistic in the New Yorker. I didn't double check the source, so I'm not sure of it, but that suggested only 20% of people of color can work at home, which means 80% of people of color, anybody who's still working, is going out to work. And my guess is what's happening is, these communities have to go out to work because we haven't given them another opportunity. Go out to work, pick up the virus at work, come home, and then it spreads inside their houses, which are more densely packed than perhaps the houses of others. That is the central problem that we haven't addressed.
That data is consistent with data GoLocal reported this morning. Rhode Island ranks 45th of the 50 states plus the District of Columbia in the ability to work at home because so many of our jobs are, listen, I'm a grocery store worker, I'm a nurse, I'm a manufacturer, I work in manufacturing, I work in hospitality. Those jobs just don't allow you to work at home.
And remember, for people of color, this is as a result of 400 years of discrimination tracking people into these kinds of jobs instead of jobs in IT and other fancy stuff that let people work at home. We are being, essentially punished for centuries of social failure. Social failure to treat everybody equally, social failure to build safe and healthy housing so that everyone has access to a decent house without cramming people together, social failure around education. Now, I think you've pointed that out in some of your editorials. Maybe this is the moment to reinvent, but certainly looking backward, this is the punishment for what we haven't gotten right so far.
Dr. Fine, you see the numbers from Central Falls and Pawtucket. What are we seeing there? It's clearly a hotbed. How bad are the numbers over the weekend?
The numbers continue to grow. As of yesterday, 445 cases in Pawtucket, 147 cases in Central Falls. My guess is that by tomorrow, we'll be over 500 in Pawtucket, over 200 in Central Falls. Remember, we're barely testing people from Central Falls in Central Falls. We've got one site, but it's only testing about 10 Central Falls residents each day. So, we just don't have, it's in that great basket of what we don't know. We are flying blind in both cities, even though the indications that we have are troubling indeed. 25% of people who are being tested at the one testing site in Central Falls are running positive, both from Pawtucket and Central Falls. That's twice the percentage that the testing percentage that's happening in the rest of the state.
Dr. Fine, what else do Rhode Islanders need to know?
Well, I think people need to know and need to have reinforced again. You're hearing a lot about testing, and you're hearing a lot about contact tracing, and that's all good. But I think the thing people need to carry in their souls is the notion that the moment somebody has a symptom, they must go into isolation. They must go into a room by themselves and stay there till 3 days after they're better. That is going to be the way to solve this, as I see it, and that's what we must do better than we've been doing so far.
And in the case of certainly disproportionately low-income folks who live in smaller housing units, maybe a single parent, that's not even an option.
And that's the challenge. So, as we address this, in my view, we've got to get opportunities for people to go into isolation outside of their house, figure out how to deal with parents who have kids, and when they're a single parent, there are a bunch of things that we've got to be doing if we're going to get on top of this thing.
Dr. Michael Fine, I want to thank you as always. A wealth of knowledge and always up to speed data. For everybody else, the governor will be doing her briefing at 1 o'clock. Again, she will not accept direct questions from reporters, either in person or via phone in front of Rhode Islanders. Those things are segregated. Thanks everybody for tuning in. Dr. Fine, thanks again so much, and all our other guests today on GoLocal Live.
Thanks, Josh.